Hi guys. Yeah, the great thing about revision is it's an opportunity for us to fake brilliance, not to fake brilliance, but to actually be brilliant. So today's topic is instruments, which I hope can be covered in 30 minutes in the final exam during practical time. So thanks to amazing videos on YouTube, I've completed it. So all I'm going to do now is just going to list it out. Okay, so it's there in the textbook, page 736 in pediatrics, OP guide. We have removal of a foreign of an aspirated foreign body. We have uh, blow to the using the heel of the hand back blows in the choking baby Heimlich's maneuver. We have nasogastric tube. We have to differentiate from suction tube. Length of the nasogastric tube. Some extra this one extra uses extra uses in cases of diagnostic, therapeutic, and extra in case of urinary tube. How do you check whether it is properly placed? And air over the epigastrium is what you'll hear. Okay. Then central venous cannula, we have to use something called Sellinger technique, wherein we use a guide wire to place the central venous cannula. Most commonly used is femoral vein. Other than that, we have external jugular vein, internal jugular vein, subclavian vein, which is the most convenient one to use, which is only issue stenosis. Capillary heel prick. We warm the baby so that a 40-degree increase of this one. In hatched areas, we alternately squeeze and release the this muscles. What muscles? Calf muscles, so that it increases the blood flow. Uh, Umbilical vessel catheterization are said to repeat over there. Arterial catheterization, what we use is radial artery cannulization, and before checking, we do Allen's test. Then intraosseous infusion, we this is a very nice method. When you cannot get vascular access, go for intraosseous infusion before going for anything else. What's the most common? This one, 1 inch below the tibial tuberosity on the anterior medial aspect of the tibia, the most preferred site. Other site is at the junction of medial malleolus and medial aspect of tibia, medial malleolus and medial aspect of tibia. Then we have above at the femoral, this one, femoral part of the knee joint. Okay, what's the most important part of this is it should be able to stand without itself. Then lumbar puncture, we have diagnostic indication, therapeutic indication, benign. Read about pseudotumor cerebri causes vitamin A vaccination, hypervitaminosis A, some vaccinations like hepatitis A, and I can't forget so bad. Then we have tetracyclines, contraceptives, anemia, steroids. Okay. Posterior superior iliac spine, crest, this shit, that shit. How much we take out? 1 ml of CSF we take out. In smaller babies, we make them flex, this, that, contraindications. Most commonly coagulopathy, shock, raised ICP, localized infection. Thoracocentesis, diagnostic, therapeutic, push-pull technique. Abdominal paracentesis and where's the location anterior iliac spine to the umbilicus. The line drawn, the junction between the medial two-third and lateral one-third is where we generally do this one abdominocentesis. Catheterization using Foley's catheter, peritoneal dialysis, bone marrow aspiration. See the diagram is labeled wrong. Is Selas, uh, this one needle. Then we have Jamshedji bone marrow needle. Uh, then why do we do below we avoid this? Why is tibia preferred 2 points? Remember for why? What are the indication of bone marrow biopsy? Pancytopenias, leukemias, Gaucher's disease, malaria, Langerhans histiocytosis, some cases for typhoid. Okay, why do we choose tibia? Tibia we choose because its cortex is thin, one. Then it is we can avoid the growth rate too, and pelvic sites are small, and it is more prone for infection to visceral organs in the pelvis. Renal biopsy and liver biopsy using the semi-automated gun or spring-loaded semi-automated gun, more specific. Mask, we have simple mask, non-breathing mask, we have triangular mask or circular mask. We have nebulizer with mask. So we have simple face mask, non-rebreathing mask with ventilator with a reservoir. Then we have nebulizing mask. We have a three-way cannula. We have nasal prongs. Other than this, we have an ambu bag which has a pop-off valve. Okay, self-inflating bag. Why it has a reservoir? It can be a corrugated tube, inlet, outlet, all that stuff. And how do you put the mask? EC technique. E for folding the mask and C for fitting the mask with the jaw. Then we have MDI spacer laryngoscope, Miller laryngoscope, Macintosh laryngoscope. Then ET tube. Remember the formulas. We have H by 4 plus 4 size of the tube. H by 2 plus 12 is equal to depth of the tube. Or birth weight in kg plus 6 is equal to depth of the tube. It is having adapter. It's having Murphy size. It's having lead line. It's having curved this one, and it's having radiopic marker throughout. Might be lead only. And a vocal guide. Then Goodway's airway or oropharyngeal airway. Nebulizer. Then we have syringe. Uh, Apart from this, we have a tongue depressor, rotahilar spacer, scalp vein set, and IV cannula set. Okay, so this finishes instruments. Uh, Remember to read ICP and remember to read from page 725 about endotracheal tube, bag and mask ventilation, basic life support, all that stuff. Indication for endotracheal, this one excessive, this one comatose patient, you need ventilation, loss of reflexes in case of comatose patient, lack of excessive work of breathing, need to maintain positive end pressure, ventilation, all that stuff. Okay, all right.